Hello, welcome back to my channel. My name is Neat Physio and this video is part one of a new series on managing breathlessness. And we're going to cover topics such as exercises to improve our breathing capacity, self-management tips to actually help you deal with breathlessness in the moment, as well as exercises on our core and our mid-back to help offload that area so that we can breathe more efficiently. But today's video is on why we get breathless and a little bit about how our lungs and our body works to help you understand actually why the exercises and the self-management tips actually work. But first, a quick disclaimer: everyone has their own medical history, social history, and physical abilities or limitations. So if you are struggling with breathlessness, always check with a medical professional because there may be an underlying condition such as a heart condition, lung condition, or something else that's triggering your breathlessness. And especially if your breathlessness is getting worse, definitely consult with a professional. It's one of those things, if you get it checked, it can get sorted quicker without so many side effects. So why do we actually get breathless then? So every single person gets breathless, and breathlessness occurs as a result of an increase of demand on the body. For example, if we walk on the flat, a lot of people will say this is light intensity. And this means that you don't feel hot, you don't feel sweaty, and really you can communicate normally. Maybe if you were going fast, you might start to notice your breathing changing. But when we reach the stairs, most people will find that by the time they get to the top of the stairs, actually they are quite breathless. They might no longer be able to chat in full sentences. You might feel a bit hot, sweaty, and your heart rate pounding. And that is a normal response. Essentially, when we've gone from the flat to the stairs requires more activity from our leg muscles, and they need a lot of oxygen and blood to actually keep them moving healthily and prevent things like cramping or injury. So what the body does is it tells the heart to beat a bit faster and for the airways and our breathing muscles to work a bit harder so that we can breathe in good quality oxygen, and then that can send nice nutrients to the muscles so that we can do that task without getting fatigued, tired, or need to stop. So breathlessness is normal. However, some individuals struggle with breathlessness, and it may be linked to various things, such as having an underlying condition such as asthma or any lung condition like COPD, certain heart conditions, even as simple as high blood pressure. Some individuals can find themselves getting more breathless. And there are many other conditions such as various fatigue conditions such as fibromyalgia, and things like anxiety and stress can make us more breathless. However somebody gets breathless, what's important to note is, generally speaking, things can improve. However, we can't always fix it. So the exercises and the advice are things to follow, but it might be things that you need to do long term to help keep things as good as you can, but we might not fully resolve it. When people get breathless with things like anxiety and stress, however, often that is linked to how our body reacts in the moment. So when we get anxious or when we start to panic, what our body does is it tries to basically focus that blood flow to where it feels it's needed most. And often what that does is it then constricts it away from our airways. So we start to use the muscles around our neck and upper chest instead of the whole area of our chest. This then constricts that airflow, and it becomes a bit of a vicious cycle because you start breathing with your shoulders and your upper chest, you get less oxygen, and you start to panic more, and suddenly you find that you're really, really struggling. So anxiety and stress, often the self-management video that I'm going to do in another week or two is really, really going to be useful for you because it just helps you refocus your brain so that we can get that oxygen into the deeper parts of the lungs. Now, a little bit of a fun fact, and I say this to many of my patients. I currently work in the world of cancer, and many people struggle with breathlessness. Now, our lungs are fascinating and actually really incredible. So our lungs are made up of the left and the right, and both lungs have lobes. And inside our lungs, and the reason we breathe so well, is we've got these little air sacs, which are just little holes that allow oxygen to be stored, and then they can transfer between the lungs into the bloodstream to take away and supply oxygen to our body. And all these little air sacs, we've got loads and loads and loads of them. And if we flatten them out like a pancake, just one person's, it could cover the surface area of a tennis court. So a huge surface of area. However, a lot of us don't utilize it very well through various things. For example, if we spend a lot of time being seated or in relaxed and reclined positions, we're starting to cut off the airways deep down. If you've had chronic infections, asthma, smoking, all those sorts of things may start to restrict the airways, and then those air sacs start to shrink or even close down. However, in a lot of cases, we can open them up. What I will say is current ex-smokers, vapors, there will be scarring that will be affecting the lung tissue. So things will improve to a point, but we can't resolve. So it's just bearing that in mind. And I personally think it's really amazing that our lungs actually have such an amazing capacity to breathe. And generally speaking, I've worked with so many patients who struggle with breathlessness. And once you get it, and you go, oh my gosh, I didn't realize that this one or two simple exercises make such a difference. The only thing I will say is, generally speaking, they're things you need to do forever. Because if you stop the exercises, we go back to bad habits, the way we breathe changes, and we start to lose that effectiveness of breathing. Now, how do we actually breathe then? So, on a simple note, we breathe in air from our nose and our mouth, goes through our airways into those little air sacs, and then, as I said, the blood flow takes the oxygen away, supplies the muscle, and then it drops carbon dioxide off and we exhale. And that happens in just one breath. It's an amazing feat that we do it all the time and we're not even aware about it, really. But there's another layer on top of that, as in the muscles that make our lungs move. Our lungs are an organ, they don't contract, but the muscles around them do. So there's a mixture of muscles responsible for breathing. I already touched on the muscles around our neck and our upper chest, and generally these are really small muscles. They are needed, but if we're only using them, we are then shutting off the airways down below. Our main muscle group then that is responsible for breathing are the muscles around here. And the big one you may or may not have heard of is called our diaphragm. And our diaphragm is a muscle that sits underneath that rib. And essentially, it contracts and relaxes to allow our ribs to expand and drop so that we can get maximum airflow into the depths of our lungs. And actually, for people struggling with breathlessness, that is the most important thing to work on in reality, because it also helps reduce your risks of things like chest infections. Because if someone struggles to breathe, often you do reduce that capacity lower down, those airways start to become a bit more compressed, and anything that could be infected, such as a virus or a bacteria, so a common cold, for example, we might not necessarily be able to shunt it away and remove it as efficiently. So doing deep breathing exercises is really important to actually also help reduce risk of infection, particularly chest infections. And then aside from our diaphragm, we've basically got all our other lovely core muscles, and they are all responsible for some role within breathing. So generally speaking, when we get to the breathing exercises, it's going to be tummy muscles that are going to help you breathe more efficiently. But before we go into that video for next week, a little test for yourselves to go away with over this next week is just have a little think about how you actually breathe. So this is a very simple test that you can do, but all I want you to do is put one hand on your chest, one hand on your belly. I'm not going to tell you what is right or wrong here. I just want you to do 5 slow breaths and just feel what hand is moving more. And then when we come to the next video, we'll go over that in a bit more detail and help you understand how we can improve that function and improve the way we breathe. So all you're going to do, hand on your chest, hand on your stomach, deep breath in through your nose, exhale through your mouth. Inhale through your nose, exhale through your mouth, inhale through your nose, exhale through your mouth, inhale through your nose, exhale through your mouth, inhale through your nose, and exhale through your mouth. Have a little think about which hand is moving more, and then when we cover the topic on exercises, you'll find out whether you're doing things well or if you need a little bit of help. And then the final thing I just wanted to cover in this video is coughing. And the reason being is coughing often goes hand in hand with breathlessness. A lot of people find that when they get breathless, they find they cough more often, or they've got these kind of dry, constant cough that's not going, or when they get really panicked, they suddenly get outbursts of coughs. And it's really, really common. The reason it happens is your body is trying to cope with that increased demand, so it's trying to open up those airways. Our lungs are filled with mucus, and the mucus is to prevent us getting ill, so prevent us getting chest infections. It shunts everything around to keep our lungs nice and clean. But sometimes if things have got a little bit squished and compressed, then suddenly you're trying to open up that airway because you're doing some deeper breathing. The mucus and everything starts to shunt, and our body kind of coughs in a response because it's like, oh, increase the demand, I'm trying to shunt things along, and we cough. But there are things you can do to actually help with the cough. And the most common thing is what we call active cycle of breathing, which some of you may know what this is, but basically it's a technique to help actually naturally shunt the mucus around the lungs so that we can cough with a controlled movement. So if you're getting lots of hacking coughs, it's a really useful technique to do because it helps over a couple of weeks start to make that cough more meaningful so that the cough becomes less often. And I'll just show you how to do that today. So similar again, hand on your chest. Always we want to breathe in with our nose and out with our mouth. You're just going to breathe in for 3, out for 4. Put your hand in the middle of your chest, in for 4, and out for 5. And then lower, in for 5, and out for 6. And then all you're going to do, put your hand in front of your mouth and do a huff. And a huff is like you're trying to mist a screen or a mirror. You can do 3. And you may find you'll cough. Don't worry if you don't cough on the first time, you can do it a few times over. But when you do it, you should actually feel things kind of moving around. And anyone would find this reactive, whether you are someone that struggles with coughing or not. But it's a really useful way of trying to get your cough under control if you're getting chronic coughs or coughs that aren't really doing anything. I would give this a go for a few weeks and see if things improve. So that is it for part 1, and today we've covered why we get breathless, what kind of conditions might cause breathlessness, a little bit about what is involved on how we breathe, and then how to manage coughing. In the next video, we'll start to look on exercises for breathlessness, so make sure you keep an eye. Let me know in the comments below if there's anything of interest that you'd like me to cover, and leave a like if you found it useful.